This, the past few sessions dealt with research integrity and ethics, and this will be, I think, the fourth or the fifth installment in terms of that series, where we will discuss biosafety or biological and environmental safety as a program at the institution. For today's presentations, you will be in the hands of myself, Winston Beukes, who is responsible for the operational aspects related to the biosafety program at the institution, and then Professor Samantha Sampson, who is the chair of the biosafety or the Research Ethics Committee, Biological and Environmental Safety, BES, and that forms one part of the biosafety program at the institution, and that are responsible for the review and approval of projects that deal with biohazardous organisms in research. So with that said, I will kick off, and you are more than welcome to ask us questions. Can I just kindly ask you have your microphone muted at all times so that we don't have interruptions whilst the proceedings or the presentations are underway. So I will kick off with the first presentation, and my slides, I assume, is also visible. Okay, so this presentation or this session consists of two presentations. I will speak to the operational aspects related to the biosafety program at the institution. That also includes the management of the REC-BES and her functions. And Professor Samantha Sampson will dive a little bit deeper into the philosophy about doing the right thing even when nobody's watching, and talking specifically to aspects related to biosafety with regard to laboratory work and the registration of facilities, for instance, and your protocol-specific application that will be reviewed by the committee. So let me just click on this slide. So as you know, Stellenbosch University has a policy for responsible research conduct, and that policy specifically speaks to responsible research conduct when research are done that involve animals, hazardous biological materials, humans for health research, and then humans for social, behavioral, and educational research, and how people at the institution need to conduct this research in line with this policy. And this policy obviously speaks to a few important aspects that we refer to as the values, and that in this case is transparency, mutual respect, and responsibility, because work with biohazardous organisms have the potential to do harm, especially for those within the laboratory, the people outside the laboratory, and also the people in the surrounding communities. So just to say this is also probably not a Sunday afternoon read, but it would be good if you at least have an idea of where to find the policy, preferably read it. But as I said, it's not one of those easy reads, so you need to schedule specific time to have a glance at it or look at it. So this policy then unpacks how research ethics at the institution will be managed. So the Senate Research Ethics Committee is the policy-making committee that is responsible for this policy for responsible research conduct. And under that policy committee, Senate Research Ethics Committee, you have about 5 ethics review committees. We dealt with the animal changes last week or at the previous session. Today we will focus on the biological and environmental safety committee, but then, as I said, you have the social, behavioral, and educational research, and then 2 HREC, health research ethics committees, that will also each have an opportunity to unpack the scope and function of the committees of these committees. So I am responsible for the BES along with my colleague Biosha, and you are more than welcome to contact us should you require information about the workings of the BES. We'll just call it the BES. So what is the scope of the committee? So this committee have been established to ensure that all research and teaching and testing activities that involve biohazardous organisms, that would be GMOs and nanomaterials, including GMOs and nanomaterials, comply with international and national guidelines on biological and environmental safety in order to prevent or reduce exposure of laboratory workers, other persons, and these other persons outside the laboratory, and the environment to potentially hazardous agents. So it is a tall order. There are a few of these committees within South Africa, within higher education institutions, universities. I do know that there could very well be biosafety committees for other private sector companies. What is important to note is that the Biosafety Committee at Stellenbosch University is not responsible or does not review applications related to chemically hazardous materials and radiation, as these would normally fall under a occupational health and safety um, program at, at a institution. So in essence, then we deal what is hazardous biological material could very well be organisms, microorganisms, proteins, genetically modified organisms, uh, and bacteria, for instance, viruses, unicellular organisms, proteins, nucleic acids, or any other infectious agent or toxic uh, organism that has a toxin. And it's important to understand that this committee will review applications where a BSL-2 containment conditions are required for working with an organism. So if your organism requires only BSL-1 containment conditions, then a review of said application wouldn't be necessary. But Professor Sampson will dive a little bit deeper into that. And then membership of the committee. So I've listed the chair and the vice chair, who is Professor Karina de Beer, who is within the virology department, and then Priyausha and myself that are responsible for the administrative function and for the management of the committee for the biosafety program. We also have very qualified members consisting of a variety of backgrounds as specialty areas. I tried to list them on the slide. In the past, we could, but we can no longer list all the faces on the slide as we are too many people now. But rest assured that you can see the membership or the members serving on the committee on our website, at the Division for Research Development's website, and then the Biosafety Committee website. And there you can see all the members. So, as said earlier in the ACU presentation, serving on these committees is voluntary for our members. They still have their academic workload, their teaching workload, and yet they have time to serve on our committee. So we are very grateful and thankful to these members. So the application procedure. So this, I've deliberately taken this video below to just show how confusing it is to look at this. But we don't want you, and I'll stop it for health reasons. So we don't want you to be or to suffer through our application procedure and be confused as this video is making my eyes going in circles. We have a two-phase approach to our application system for the Biosafety Committee. Firstly, we need you to register your facility. What do we need with that? Or mean with that? We want you to tell us what you have in the facility and how you store it. Where do you store it? What is the access control look like? What does the signage look like? Who's the responsibility or the responsible person? How does access control look like? And how do you manage waste generated by these various activities using these biohazardous organisms? So once we know what's in your facility, we know how you store it, and we know what you do with it. Once you finish working on these things, we want you to now tell us what specific project using a specific agent or organism listed in the facility registration that you're now going to use as part of your bench work. So, and here we want to know the focus is on who is the person doing the procedure or this submitting the application. Do they have proper biosafety training? And we have a biosafety training course on Sunlearn that is available to everybody registered students and staff at the institution. We would also then want to see SOPs for the use of these organisms and how you are going to manipulate them and work with them, along with risk assessments for each of the associated risks for working with this specific biohazardous organism. And it's important to distinguish it like that. If not, you will be confused like this picture is confusing me. So we want you to contact us. We want you to engage with us, consult, so that we can provide clarity should there be no clarity on a particular matter. So it's the two-phase approach, and I can happily say that the majority, most of our laboratories that require PSL2 conditions have already been registered with the REDPES. It took some time. Obviously, with the new system, it takes some time, but happy to say that those facilities are already registered. And now we are at the point of accepting for the past years already project applications that can be conducted in those registered facilities. Then, secondly, what is important from a governance perspective or an admin perspective is that when you have to submit either a registration or a protocol application, that you access our website and find the meeting dates, and especially in your case, the closing dates. This is very important. These dates are scheduled the year before. So by October, we have to submit these dates to the university's almanac, where these dates are then listed. So it is important that you meet the deadlines. If you do not know the deadlines and you come to us trying to submit an application, we will ask you, do you know about the deadline? And if you say, no, I didn't know about the deadline, we will look at you like this kitty is looking at us now, very stunned and not knowing what to do. But if you need your application to be expedited, we have a process for that. But expedited reviews are not routinely approved in terms of the review being expedited because we have the meeting dates published well in advance. So please, if you're unsure on where to find the meeting dates, please send us an email. We will gladly share the URL with you so that we get your application serving at the earliest meeting and not suffer through missing deadline upon deadline. So what is important is to note that you need to submit your application on time, that when you submit, that you, if you're a student, that your supervisor is well aware of what you have put in the application. If unsure, please consult with the ethics office. You can do so by making an appointment. Some of our applications have horrific spelling and language issues, but that is not necessarily a safety aspect unless you spell the name of the thing incorrectly and um, causes confusion. Visit our website for the dates, get to know the application system, and follow up on your progress of your application. If you submit in March, please don't follow up in September saying that we didn't know or we didn't receive any feedback. Follow up in April. And then lastly, before I hand over to Samantha, don't be stressed out about it. We are quite capable persons within the Office for Research Integrity and Ethics, Beukes and myself, with the assistance of when complex matters are discussed by Sam and Karina. So we are here to support you in your research endeavor and willing to do so. And that is about it. Thank you. And I'm now going to hand over to Samantha for her presentation. I think we can take questions right at the end. Thank you. Over to you, Sam.
Thanks, Winston. I'm just going to share my slides quickly. Sorry, I apologize in advance. I am working from home today and the dogs may have opinions on biosafety as well. So if that happens, I apologize. Let me just get this going. By the way, can I just confirm that you're seeing my slides? Not, yeah, okay, thanks. Thanks, Winston. So before I start, I think it's really important to just acknowledge the support, the incredible support we get from Winston and Beukes, who really keep this committee going. And of course, to my co-chair, Karina, who is just a great partner in this endeavor. So thanks to all of those people. So I wanted to just first of all, after that, thanks the DRD for organizing this series, because I think it's really important to keep people informed. And the reason why we are now have much better coverage of the labs that need to have approvals by us is because of information sessions like this. So thanks for that. And as Winston has mentioned, I am representing the REC-BES, or Research Ethics Committee for Biological and Environmental Safety at Stellenbosch University. So I'll be talking a bit about the role of the committee, hopefully not repeating too much of what Winston said, but I'll also talk about some of the elements we consider when we review applications in a very broad way, and then how to go about applying, and importantly, some of the common errors we encounter in applications. So much of your work for people in this audience may not require REC-BES registration, but I think it is worthwhile to have some awareness of how to think about biosafety and why it matters. So some of the things that we require for the REC-BES applications are simply good laboratory practice. And this ultimately supports rigor and reproducibility in research and effective use of research money that is often very scarce. And I think this is something that is worth all of us striving for. So for those of you who deal with biohazards in your day-to-day work, I apologize for going back to basics here. I'm sure you are very familiar with these, but I think it's always useful to start off with some fundamental definitions. So the crux of our committee is biohazards and biosafety. But I think, so just to pause on biohazards, these are risks to the health of humans or the environments which arise from biological work, and that's especially work with microbes, that's bacteria, viruses, and fungi. Oops, let me get that moving. And then biosafety refers to the practices and equipment that is applied to prevent exposure to potentially infectious agents or biohazards. And it also refers to the containment conditions under which these agents can be safely manipulated. So the purpose of all of this is to protect people, animals, and the environment. So a question that often comes up is, why does biosafety fall under research ethics remit? So to address this, I fall back to the common definition of doing the right thing even when no one is looking. And Winston already alluded to this earlier. This is, in another way, we can think about this as doing the right thing even when there are consequences for you. So in a lab, a consequence of adopting a safer working practice might be that something will take you twice as long and cost you more, but it's the right thing to do. So in more academic terms, we can think about at least 4 principles of biomedical ethics that apply here, namely autonomy, which is respect for the person, beneficence, where there's a benefit to the research participant, non-maleficence, which is the absence of harm to the participant, and then justice. So this refers to equal distribution of risks and benefits between stakeholders. So in my science-minded view of the world, our RIC-BES review process is really heavily focused on non-maleficence. That is the absence or minimizing of harm to participants. And participants here include the researchers. So the general philosophy of good biosafety practice is the application of common sense. And I have to say that in my more than 20 years of lab experience, common sense is not common. So what we mean by this are practices including exercising reasonable care, using your equipment and reagents safely, and then only performing tasks when you are adequately trained. So training is a really important component that we emphasize. Cooperating with others to ensure a healthy and safe workplace, and following the policies and procedures that are implemented in specific laboratories. So there's a long history of the awareness of the need for good biosafety practices and the lack thereof. So although the studies I'm citing here are not the first or most recent of their kind, this particular duo, Salkin and Pike, published several frequently cited studies on laboratory-associated infections, or LAIs. In these, they surveyed over 5,000 labs and cited over 3,900 cases of LAIs. Worryingly, more than or fewer than 20% of the incidents were linked to known accidents. So this means that the risks, the incidents that led to these exposures were either not recognized or the incidents were not reported. And I'll come back to reporting in just a moment. So these studies concluded that more than 80% of reported cases were likely due to exposure to infectious aerosols. So as a TB researcher myself, infectious aerosols are something that we work very hard to avoid. And of course, the COVID-19 pandemic brought this into very sharp focus, which we are thankful for in a way. But all of these studies highlight the need for clear guidelines on safe laboratory working practices. So this agenda of lab safety was, of course, further promoted by the HIV/AIDS era, which prompted extensive legislation and guidelines for work with potentially infectious biological samples. And studies have shown that this has had a very positive impact on reducing the number of laboratory-acquired infections. But we can't afford to let down our guard, because there are continued risks that are inherently associated with laboratory work. And good biosafety practices are an ongoing work in progress and should be continually monitored, evaluated, and refined. And this, I believe, is part of the function of our committee. And we certainly don't want to be the ones in the news that are accused of being responsible for a new outbreak of anything. So typically, institutions that work with potentially harmful biological material will have a committee like ours or similar that is in charge of the institution's biosafety. So this committee would create and monitor the biosafety standards that need to be met by researchers to prevent the accidental release of potentially harmful biological material. As already alluded to, a key function of this type of committee is to help protect our personnel, the public, and the environment. And a fourth entity that is often overlooked is that of our product as a researcher, that is our data. So consistent and safe working procedures will help to ensure the quality and reliability of this product. Other considerations are certain funder requirements, as well as legal considerations in terms of occupational health and safety. So I won't have time to talk about all of these, but of course, this is an important function of such a committee, that is to ensure that these requirements are met. And the final point that I want to make is perhaps a more abstract one. And that is that I believe that if operated correctly, this type of committee can ultimately also help to foster a positive culture of biosafety awareness. And I say this because my experience over the years has been that there tends to be the perception that it's not really cool to be concerned about biosafety, and that there can be a surprising amount of peer pressure and negative attitudes. And this is often from quite senior staff on this topic. And this is important because no matter how good your physical containment measures are and your written rules are, they are subject to the human factor. And studies have shown that the behavior and attitudes of workers can have a significant impact on the likelihood of them being involved in lab accidents. And here we have listed a few characteristics of those likely to have fewer or more accidents. And this does seem a little bit biased towards the younger male demographic. So I think it may be a bit idealistic, but approaching this committee in the right way offers a unique opportunity for researchers to turn attitudes around, to help to educate and to encourage peer pressure to be applied in a positive way. And I personally would like this committee to be experienced as a useful instrument to encourage safe working practices and consequently support good science, rather than just being a box-ticking exercise. So turning back to the specifics of REC-BES, I'm not going to read everything that's on the slide, and I know Winston has already covered some of this. But just to say that we are mandated by the Senate Research Ethics Committee to review and approve research that is potentially hazardous to humans, animals, or the environment. So as Winston touched on earlier, our members have a broad depth of expertise. And we have members from the Faculty of Medicine and Health Sciences, Food Sciences, Microbiology, along with experts in nanomaterials, genetically modified organisms, and occupational health and safety. Many of our members are or were recently actively working in laboratories. So I think for the most part, we take quite a pragmatic approach to the review of applications. So although it doesn't always seem like it to applicants, especially those that are less experienced, we try to educate and facilitate rather than obstruct research. So we often encounter some confusion around research that has to be reviewed by multiple committees. So as a starting point, I urge people to look at this handy infographic, but again, talk to your Research Ethics Committee representatives. So one of the things that we are working towards is better communication and integration between the committees, and we can advise on how best to start the process for greatest efficiency. So I think it's really important to stress that the Research Ethics Committees review different aspects of the research. So approval by one committee does not necessarily mean that you are fully compliant, and it's always best to just check. So over the next few slides, I'll cover some points that are probably more relevant to actual applicants, but I think it's worth mentioning for a general audience as well. But I won't go into heavy detail on this. So there are several very common errors or omissions that we encounter when reviewing applications. So again, first and foremost, my advice to researchers would be to get input from the committee before they start. Things that are often missing or inadequate include things like floor plans, risk assessments, SOPs, documentation. So I'll come back to risk assessments and SOPs in a moment, but just to quickly mention, in terms of documentation, here we're referring to things like training records, evidence of decontamination procedures, service records, and so on. In terms of training, we recently provided a collection of training materials, which provides some basic information on biosafety, which is available on Sunlearn. And if you get in touch with the committee, we can direct you towards those. So I think a really critical thing is to leave enough time. It is always going to take longer than you think to put together your application. And as with most things, if it's rushed, it's likely to create a poor impression and require revision, which will further delay the process. So one of the things that often trips up applications is SOPs, or standard operating procedures. And so these are obviously needed for specific experimental procedures, but also for specific activities such as transport, waste management, and spill procedures. So we have developed an SOP template and a guidelines document that will shortly be available on the website, or you can reach out to BIOSA. But just to quickly mention a few features, so we obviously would expect your SOP to have a name. It should have a version number. So version control is something really critical that is often problematic in those SOPs that we review. It should have an effective date and a record of who wrote it, reviewed it, and approved it. And then, as I mentioned, we do have a guidelines document that can be very helpful in developing your SOPs. So then on to risk assessment. So when managing risk, we need to first visualize possible routes of exposure, to identify and measure the risk, and then implement measures to control, minimize, and where possible, prevent the risk. So in the interest of time and not boring everyone, I won't go into all the detail here, but very briefly, risk assessment needs to consider the worst case scenario. So this takes several factors into account, such as how likely this would be, how serious this would be, and how could an incident be managed. So once a risk has been identified and evaluated, appropriate preventative measures should be developed. So a useful tool here is the risk assessment matrix, where we consider the likelihood of risk, relative severity, and relative severity of the consequences. So based on appropriate risk assessments, organisms are classified into 4 levels of risk groups, and that's detailed in the slide. These range from those in risk group 1, which pose little to no individual and community risk and are unlikely to cause human disease, all the way to risk group 4, where there's a very high individual and community risk, a serious disease, easy transmission, and no preventative measures or effective treatments. The organism risk group, in turn, determines the biosafety level required. Again, this ranges from level 1 to level 4. So the table that I'm showing here, don't worry about the detail. It just is serving to provide an overview of the agents, specific practices, and primary and secondary barriers that are associated with each of the 4 biosafety levels. As mentioned, I'm not going into all the detail here, but most of what we review for REC-BES falls under biosafety level 2 or biosafety level 3. So as an example of primary barriers that we typically see in a biosafety level 3 setting, here we would have the so-called PAPR or personal respirator, which has got its own power, and a biosafety cabinet, which this researcher pictured here is working in. So not visible in this picture would be secondary barriers or engineering controls, such as negative pressure in the lab relative to the outside. And in most biosafety level 2 labs, we would require some measures such as those pictured here, which would include protective eyewear, hand protection, that is gloves, a closed lab coat, pants that cover your legs, and closed shoes. And then with a little reinforcement from a friend, we would expect hair to be tied back and out of your cultures. So I think another really important consideration when you're developing your standard operating procedures is also to have very clear guidelines and procedures for incident and near miss reporting. So when mentioning this, I think it's critical to convey the message that this is really not about policing in the negative sense. And where some accidents may be hard to hide, it's actually the near misses and what some might consider as minor incidents that should be really viewed as opportunities for improvement. Often these incidents and near misses reveal inadequacies in procedures or in training, and identification of these can help to avoid such incidents or more severe accidents in future. And I therefore urge researchers to outline clear reporting procedures as part of their protocol development. So I don't need to go through how to apply. Winston has covered some of this, and it's also available on our website. But I will leave you with a few potentially useful resources. So a lot of what we assess applications on comes from sources such as the CDC and WHO manuals. And as I mentioned, we also have provided some basic biosafety training materials on SunLearn. And I've just provided a link to the website. And I'm going to stop there. And of course, we are happy to take any questions.
Thank you, Sam. Colleagues, do we have any questions? Whilst we have Sam, Karina, Beatrice, and myself. Yeah. Any questions? It seems that we have clear presentations and without any uncertainty.
I see a hand.
Okay, we have Mrs. MC Kluter. Please unmute yourself and then you can engage with us. Thank you.
Thank you. Thank you. I just want to know where can we access the Stellenbosch University safety guidelines and manuals when regarding to yeah.
Okay, so if you're referring to what we've discussed now, the biosafety
Yes.
the documents, that would be on our website, and I'll put it in the chat.
Thank you.
And you can then go to research development, and on that website you should find aspects associated with research integrity and ethics, and then find the biosafety website. The URL for the biosafety website direct link is, you need 2 PhDs and a master's and some school certificate to remember that.
Thank you.
Any other questions? It doesn't seem like that. Thinking we are preaching to the choir here, because
Yes, I was thinking, looking at the names on this
Yes.
audience, I think most of these people know what they know what they're doing.
and we are very happy that they do know. Okay, so we won't drag the cat on the floor any longer. So we are going to say thank you to you for availing yourself for this session. Please be on the lookout for an additional session for the series or for research integrity and ethics. I think it will be the social behavior and educational research along with the health research ethics committees. That will be up next. Register and again support these sessions. Thank you to Samantha for a wonderful presentation. And thank you to Karina for your support, and to Bielsa as well. Thank you, colleagues.
Thank you. Thanks all.